Thank you all for joining us today for this week's virtual panel, Aging, AVs, and Rethinking Mobility. You can find the full recording of this panel and all the others from our February and earlier on our website at www.pavecampaign.org or follow us on social media at PAVE Campaign to keep up with all of our work. My name is Tabitha Coulter, and I'm PAVE's Director of Operations and your moderator for today's panel. Today is the final panel in our February series where we focus on equity and AVs. Driving automation touches on many different equity topics, and we're excited to be using this final week in February to discuss AVs and older adults. Our first panelist I'd like to introduce for today is Kathy Cameron, Senior Director of the Center for Healthy Aging at the National Council on Aging. Yes.
Oh, thank you so much. Great to be here.
And our second panelist comes from PAVE member Voyage, who has experience with AV deployments in retirement communities, the Villages. Nina is the Chief Operations Officer at Voyage. Nina, pleasure to have you.
Thanks for having me.
And finally, our third panelist comes from another PAVE member, Nuro, whose autonomous vehicles are designed for local goods transportation. Greg is Nuro's Public Policy Manager, and we're thrilled to also have him here.
Howdy, thanks for having me. Appreciate the invitation.
Yeah. So in today's panel, what we want to look at is older adults and how AVs could increase mobility options for this growing demographic. Many older adults face reduced mobility as a result of many different factors, which can complicate essential tasks like attending medical appointments, buying food or other goods, and staying connected to friends and family members. So let's start by kind of giving the audience more information about the scope of what we're talking about. Kathy, could you give us some ballpark numbers of how many Americans fall into this demographic and how many face some form of mobility challenge?
Sure, I'd be happy to, Tabitha. Thank you so much. And for those of you who may not be familiar with the National Council on Aging, we are the oldest national organization dedicated to improving the lives of older adults. We've been around for over 70 years, and we focus on healthy aging. I direct the Center for Healthy Aging. We also work to improve access to benefits from the federal, state, and local level for older adults or persons with disabilities. We have a very active policy and advocacy department that works to defend and protect important programs like Medicare, Medicaid, and the Older Americans Act for older Americans. And we believe that every person deserves the right to age well. And a key part of aging well is the availability of safe, affordable, accessible transportation options in communities across the country. You know, most older adults want to age in place. They want to stay as independent as possible. They want to be active. They want to be engaged in their community. And so having reliable transportation as they age is key to quality of life. Every day in the United States, 10,000 Americans turn 65. And this is due to the aging of the baby boom population, those born between the years 1946 to 64. And currently about 16% of the population in the US is over the age of 65. And it's about 54 million people. And over the next several decades, the number of older adults is expected to increase to about 23% of the population by 2060. And we know with aging, often disability becomes more common, and that affects about 2 in 5 of all older adults, those 65 and older. And the most common type of disability is mobility impairment. Nearly 40% of people age 65 and older, have at least one disability. And 2/3 of them say that they, have problems with walking or climbing stairs. And the most common causes of this type of disability are, chronic conditions like osteoarthritis, neurological conditions such as Parkinson's disease that increases with age, or even, back and spine problems or injuries. We do a lot of work at NCOA around falls prevention, and falls result in injuries. So that can also increase mobility problems among older adults, as well as things like obesity and heart disease. And we also know that, the younger population with disabilities, those who might have been born with a disability, such as cerebral palsy, or those who acquire a disability, say, in their 20s or 30s, like those with spinal cord injuries, those folks are living much longer lives than ever before and are really looking for, mobility and transportation options so that, again, they can remain as independent as possible throughout their lives. So I hope that kind of helps provide some background, in terms of the scope of the issue.
Yeah, absolutely. And now I kind of want to turn to Nina and Greg and ask, kind of at a basic level, how could AVs help with some of these challenges that Kathy helped describe? Nina, could you start?
Yeah, sure. So in a lot of communities, we see that there are just really limited options besides personal car ownership and driving yourself. So in a lot of these communities, including for senior citizens, you're really relying on friends and family if you cannot drive. So that's just really difficult. Public transportation in a lot of suburban areas is not readily available. Ride sharing, for a lot of reasons as it exists today, may not work. So we really see a lot of demand for self-driving vehicles to fulfill just day-to-day activities. In fact, in a recent survey of our communities, which we have two, one in San Jose and one in Florida, over 70% indicated they would use our service and are more likely to use the service if it was self-driving. I think this really speaks to the demand that exists for these senior citizens and for these communities to have safe, accessible transportation. And a lot of this is just about day-to-day use cases, right? Going out, being able to see friends and families, going to medical appointments. There's a profound implication for being homebound and just the loss of independence and mobility, and that's linked to faster declines in physical and mental health. So for us, transportation is very much also a public health issue, and we very much believe that AVs could pave the way to provide more accessible mobility for everyone.
Yeah, and Kathy also made that point, about the need to improve accessibility of mobility options. And Greg, I was wanting to turn to you and ask about, what are some other ways that AVs can improve the quality of life, by possibly bringing goods and services to them?
Yeah, thanks for the question, Tabitha, and thank you again to PAVE for hosting this important discussion. Really excited to be learning from Nina and Kathy as well about their experiences. I think it's really important to think about the impacts of transportation and mobility obstacles on older adults in terms of health, nutrition, and overall quality of life, and the ability to experience the independence we've been talking about. I think there are three important statistics that kind of help to set the stage here. The first is that almost 10 million adults age 50 and older are at the risk of hunger daily today. That's about 1 in 6 seniors who face food insecurity. That results in about $130.5 billion in annual healthcare costs resulting from food insecurity. And 13 million adults over 50 receive food access from food banks annually. So happy to give you guys some quick background on Nuro to explain what we're doing and then how we're sort of looking at this question. So first of all, Nuro, we're about 4.5 years old. When you're a tech firm, you measure it in the halves as well. But we're focused on creating AVs for local deliveries. And so it's show and tell time with Greg Rogers as usual. So we built the R2, which is a custom occupantless delivery vehicle. It's autonomous, it's electric. It operates on public roads. We received the first exemption from NHTSA for AV with novel designs last year. Especially designed for delivering goods. So we have 2 compartments here that were designed to be sort of at the right dimensions where folks can access it, whether you're standing, walking, rolling in a wheelchair, etc. We can get a little bit into that in a second, but our focus is on providing those local deliveries by partnering with local retail stores in your community. Now, what does that mean? That means partnering with Kroger, as we've done, CVS, Walmart, as well as sort of prepared food makers. So that includes Domino's. So today in Houston, we're delivering fresh groceries from Kroger, prescriptions from CVS. And we also received a permit to do commercial deployment in California in the Southern Bay Area soon. But the reason the goods access is important, I think it's important to think about this in terms of seniors, is 43% of household trips in the U.S. Are conducted in personal vehicles are for grocery shopping and errands. When you lose the ability to drive, then you start to rely upon, of course, upon friends and family, but also you rely upon paratransit services. And when we're thinking about vulnerable communities, when we're thinking about equity, currently there are 20 million low-income Americans that struggle with food access. Our analysis found that we can help to serve about 70% of that population with delivery AVs. But the thing is that with more and more seniors choosing to age in place, we need to give them options that meet their needs. Number one, this means healthier communities that are built to where they're walkable. to providing public transit. You know, we're not going to pretend that AV is the only solution here. It's really a quality of life question, but there are other things where AVs can help. So of course, Voyage is working helping to get people where they need to go. But with Nuro, we're focused on also helping people to access the things that they need, whether it's uncomfortable to go to the store, whether they're unable to go to the store, or whether there are other challenges that they face. So I do want to be humble. You know, AVs aren't going to solve every problem at once, but at Nuro, we see a big opportunity to sort of help to bridge those gaps in transportation, connect people to the things that they need.
Yeah, thanks. And as we're kind of thinking more about those, actual use cases and uses for AVs, I want to dig down a little bit more into that. And Kathy, I was wondering if you could kind of start us off. We had an audience question asking about, what are some of the top services or functions by AVs that could help meet the needs of the aging population? Could you share with us some of what your thoughts there might be?
Yeah, great question. At NCUA, we work with a network of community-based organization that serve the needs of older adults. And, we've certainly learned a lot during the pandemic about what the most pressing needs are. And Greg certainly touched on that, and that is food. So there are Meals on Wheels providers across the country that deliver food to older adults who aren't able to get out, who might be homebound. And I really see AV as a possibility for assisting in that function. And we also found, during the pandemic that many of the drivers for Meals on Wheels were older themselves, and they were not able to continue, because of the risk to themselves in serving that delivery function. So AV can certainly fill in there. Also just, general transportation, many area agencies on aging across the country, and they are available in communities all across the country, cities, counties, who connect older adults to services, and often they support transportation services like paratransit. And I think as the need continues to grow, we need more options for transportation. To help people get to the doctor's offices, to get to places so they can socialize with other older adults or family members. And senior centers is, I think, another excellent place in which AV could be used to transport older adults to senior centers. Senior centers are not well funded, to be honest. So it's hard for them, to buy vehicles. So we need to make sure that, the AV is affordable for these types of places. But I could see them, picking up seniors, to take to the senior center and then return back home. Yeah, I also see, AV as being great just for helping older adults who want to go on outings with other friends. And, the vehicle can go from, house to house to pick up the older adults, take them to, a museum or a park, or connect them with their family members. So that there's so much potential here, I believe.
Yeah. And Nina, you and your organization Voyage, you have a unique perspective of that real world experience in bringing AV technology to older adults in retirement communities. What has Voyage learned about the challenges facing older Americans who live in those retirement communities and how you've been able to help them?
Yeah. So to give a little bit more background, Voyage is a self-driving car startup that is focusing as a first market in the retirement communities. We are developing full stack self-driving, so everything you see from a software perspective to be able to make that car drive by itself. And what we really believe is that it's really important to deliver this technology to people that need it. And in our opinion, senior citizens is one of the most is that population that truly needs alternative transportation options. For us, we want to use self-driving vehicles as a way for them just to make their day-to-day lives easier. That's why we're offering a door-to-door on-demand service, because just because you can't drive doesn't mean you shouldn't have the same type of social life that someone that can drive.
Mm-hmm.
And for a lot of these seniors in these communities, even if they are able to drive, they've cut back on driving in some way, whether it's only driving during the daytime or driving short trips or when there's no traffic. So what that really means is what they want to do in these communities is very limited if they rely on their own abilities to drive. And when I talk about these communities, these are huge communities. Our community in Florida, the Villages in Florida, is 125,000 people. It's over 60 square miles. It's essentially a small town. And there are lots of activities. There's enough golf holes for you to golf every single day for over 2 years. And these folks just want to age gracefully and have active activities in their later in life. And what we're trying to do is just make it more accessible for them so that anytime they need a vehicle, they can just summon a vehicle and they can go wherever they want, and it's always available for them. And one thing that we've really learned as we've spent time in these communities is just making sure it's accessible for everyone, whether it's mobility issues, whether it's hearing impaired, vision impaired, whether it's app itself and the fact that two-factor authentication is maybe a little bit challenging for certain folks. We want to make sure that from a product perspective, we're spending a lot of time in order to make it as accessible as possible for every resident in these communities.
Yeah, absolutely. And Greg, are there other sort of accessibility considerations? That's one we hear about a lot, of course, with this population that, AV companies and designers need to be taking into consideration in order to serve the need of the older population well?
Yeah, that's a great question. I think there are two things that I want to talk about here. The first is more around sort of accessing the groceries themselves. We're going to use groceries as an example for accessing goods. And the second is around the designs of the vehicle that you're using, maybe to fulfill that need. So the first, in terms of accessing groceries, a person in a wheelchair or someone with limited mobility, excuse me, often has difficulty finding reliable transportation, whether it's public transit, whether it's relying on caretaker to drive them. But also, as was discussed earlier, even if they're able to drive, there are other sort of impairments that they can face. But even after you get to the grocery store, there are other questions, right? Sometimes things are put too high on the shelves for someone to be able to reach. Sometimes walking around the grocery store is difficult for someone who can't stand for a long period of time. And so there are a lot of questions just there, just around, it's not just about getting to the grocery store, it's about being able to actually pick and pack your cart. So we designed a service that helps to address some of this, but what's more on the vehicle side, we believe it's important to talk to people who are ultimately going to be the end users. And so what we did was we actually interviewed folks who were, potential end users in developing this generation vehicle and our next generation vehicle, and considered things such as, the height of the compartments, the depth of the compartments, so you can reach into them even if you're in a wheelchair. And the things that we can do from a design perspective to make sure that from the moment that vehicle gets to the curb, the R2 arrives at your curb, it's the moment that you bring those goods inside into your house so you can cook dinner, that we're making that as seamless as possible for consumers. And those are the kind of things that we have to approach it from a design perspective on thinking, how can we actually improve people's lives in the process? It's about a lot more than just throwing sensors in a computer on top of four wheels. It's about thinking about the human element behind it.
I have to jump on the fact that you're talking about speaking to the end users. Obviously, an important part of our mission here at PAVE is that public education, that knowledge and that understanding of these technologies. Some of the most common questions we got from this panel were questions about public acceptance, how people accept or think about this technology. So I want to get to this topic for a bit. So Nina, starting with you, kind of based on Voyage's experiences in the villages with these deployments, what can you tell us about any specific challenges around the acceptance of the AVs as a technology among older adults? Are there any lessons that you've learned that you can share on how you've helped them feel more comfortable?
Yeah, so perhaps maybe to contrary to public opinion, we've actually found our residents to be very accepting of self-driving as a technology, as in more of a means to what they can accomplish. I would just note that this demographic has seen a lot of changes over the last decades, right? Birth of commercial aviation, the introduction of cruise control, seatbelts. So I do think they understand that technology can benefit their day-to-day lives. And what we've done a lot in our community is just to educate them about how self-driving car works, why we're developing it, and what that could mean to their day-to-day lives. And then quickly the conversation changes from what is that funky looking thing, the LiDAR that's spinning, to how can I order this vehicle to take me to a place that I need to go. And one thing that we've really been proud of is just being able to introduce a self-driving vehicle into the community and letting people take rides. So we do have multiple marketing events where we call it Try a Ride, which is, here's a route that the AV is taking. Why don't you just get in and experience it yourself and ask as many questions as you want to get comfortable with the technology and what it's capable of? So from that perspective, we found very wide general acceptance. And I think that was borne out by some of the surveys we've done where, over 70% are excited for this technology and want to use it. And we very much believe that education and just introducing people to AVs, so that it's not just something they hear about in the news, it's not something they just hear about from friends, but truly experience it themselves, will really help broader adoptance for this technology.
Absolutely. And Kathy, are there any other insights you can share with us on adoption of, other new technologies by older adults, or anything you'd like to see in this space done with AVs?
Yeah, I'd love to, echo what Nina just mentioned. I think education is key, and that having that direct experience too is so important. But I wanted to mention a couple of things. One is we conducted a national survey of older adults with some funding from Volkswagen Group of America. And we asked the respondents, what are some considerations for transportation options for them? And some of the things that kind of came to the top are safety. That was number one. And I think, as people get educated about some of the safety features within AV, that's going to be so important. Physical assistance available. So that kind of touches upon some of the things that Greg mentioned, grocery shopping and when bringing groceries back to the home, for example, the quality of the service, convenience. AV is all about convenience, right? And the cost. That's really critical for older adults because many of them are on fixed incomes right now. But one thing I want to mention, in terms of adoption of new technologies, we have seen so many changes just in the past year in the adoption of new technologies among older adults. Some of the work that I do at NCOA is to help community organizations implement health promotion disease prevention programs. And traditionally, these programs are in person in places like senior centers and YMCAs. Well, when the pandemic started in March, we had to move to virtual delivery for all of these programs. I mean, it was an amazing shift, a big pivot. But they have done amazing work to educate seniors about how to use platforms like Zoom or Facebook Live. And we have seen amazing transformations in the adoption of these programs in the home. First of all, it's a great way for older adults to connect with one another. Once they get to know Zoom, they use it for other things. They connect with their family members and their friends, and they're more adept to with telemedicine, which is so important for connecting with their physicians in the healthcare system. So I'm, very encouraged by the use of AV and the adoption among older adults over the next few years. Again, it's all about experience and education.
Absolutely. And Greg, I know, as you've kind of said, you're really passionate about the impacts that AVs might be able to have in the mobility space, especially for issues like food and medicine access. Obviously, we're all passionate about it, of course, but I was wondering if you had any other thoughts to add about how, addressing those real needs might help impact people's perception of technology.
Yeah, and first of all, I want to give major props to Nina and the team at Voyage for all their work on public outreach and education. I think that the work over there that you guys and Oliver is doing just on helping people understand the technology is just really incredible, and I think that goes a long way. And also what helps is introducing people to technology and meeting them where they're at. One thing that we've done at Nuro before we launch any services, we engage with the community. We go out and talk to folks. We'll bring R2 to the local retail stores so people can sort of interact with it and see it in person, and also inform people that R2 is going to be around their neighborhood and that it's available to them, and helping people understand here's where you can order it from. Our partners such as CVS or Kroger, you can go to the website and select if you want an order from a NeuroBot. And then, just answering the questions, being there to answer those questions of the community and helping them understand how the technology works. It is really important. That openness, that transparency is what's going to build trust over time. And, with, I think that, it's sort of a lower barrier for trust is the thing when you're getting your groceries delivered, because whenever generally if you're ordering grocery delivery, you're probably getting it, in some places you could be getting on a bike, you could be getting on a car, and you don't care if it shows up in a Toyota Camry or a Honda Accord or whatever it is. So those are good ways to sort of build that trust over time while, safely piloting the technology.
Yeah. And Nina, as we're thinking about how AVs might add value to communities, I wanted to get your take on another audience question we received. This person said, many retirement communities already have shuttle services that they provide their residents. What are some value propositions we can share with them to talk about the value of an autonomous fleet?
Yeah, so I think in general, more transportation options is always better. But I do think shuttles and a door-to-door on-demand service provides two different value propositions. Shuttles are obviously really great if you have a routine schedule and you're wanting to move large amounts of people for things like events. But what we've noticed, and which is why we are introducing specifically on-demand and door-to-door, is that there are just times where you can't plan your schedule in advance. So having that flexibility is important. And then perhaps more importantly, it's hard to walk to a shuttle sometimes, especially if you have mobility challenges. And asking seniors to potentially always do that can be tough. So we very much want to offer a door-to-door service so that we can limit the amount of just walking that someone needs to do to be able to go to their final destination. And this is also something we think about as we design the vehicle itself, right? Asking folks to really walk into the vehicle or step down into the vehicle could be challenging. So my short answer is I think there's room for both, and I think they serve two very different value propositions. And it ultimately comes down to just giving consumers more options so that suits their needs.
Yeah. And Kathy, obviously, there's a complex network of services already being provided to older American communities by government and nonprofits, things like paratransit or Meals on Wheels. And, we aren't suggesting that AV technology could or should wipe out those important services. So could you talk a little bit about the importance of those services and how you might see AVs as an opportunity to work with and build upon those for older communities?
Yeah, I really feel that, AV adds more options to what the aging network is currently providing. And hopefully over the long term, maybe less expensive options for them to use. Major challenges with transportation is in rural communities. I mean, we hear that, all the time. So I really see AV as a wonderful service that could be provided in those rural communities. And there are so many older adults living in states. 3 of the 4 states with the highest percentage of older adults, Maine, Vermont, and West Virginia, they have over 20% of their population are older adults, very rural states. So, being able to augment existing transportation with AV is so important, I think. So definitely want to mention that. I think another challenge I failed to mention earlier is, something we're working on at NCOA is, technology literacy and the digital divide, because we need to make sure that older adults do have access to technology, whether it's smartphones or tablets, laptops, et cetera, and also be educated in how to use all of the various apps. So hopefully all of the companies that you're working with are building in that educational component, maybe, group or one-on-one based education for older adults.
Yeah, we've actually spent some time just working with our residents to make sure our mobile app is as friendly as possible. So
Great.
basically one big fat button that says Summon Ride, but there's just the font specifically and the size of the font. We spent a lot of time thinking about that. We wanted to make it as frictionless as possible so you don't have to enter your final destination on the app. You don't have to drag a pin around, all those things that could be challenging if you're not as familiar with a mobile app or just maybe have mobility issues with your fingers. So we have spent quite a lot of time and would love to work with National Council on Aging in terms of figuring out a better way or even improve our products to make sure that it's truly accessible for everyone.
Thank you.
And Greg, too, as our public policy person on this panel, I wanted to kind of end with you and ask, is there a role for the public sector here to be involved in these efforts, as well as industry, like you and Voyage and Nuro and nonprofits like National Council on Aging?
Yeah, absolutely. I mean, there's a huge opportunity to partner on making sure this technology is helping to serve the folks who it can help the most. And so we're always looking for opportunities to partner with cities and to help meet needs for essential services. So, for example, we're doing a pilot delivery service right now for Houston Metro paratransit customers. We're really excited about this because a lot of metro organizations during the COVID-19 pandemic needed to sort of shift to looking at food delivery as another option. And so, really excited to start working on providing this low-cost, sustainable delivery service sort of in the region. And seeing how we can expand that in the future. And we've been partnering with food banks throughout the pandemic. We're excited to sort of continue that and to look at what more can be done and how we can be a partner.
Yeah. Well, sadly, those 30 minutes went crazy fast. But Kathy, Nina, Greg, thank you all again for taking the time to join us this afternoon to discuss this topic.
Thank you. It's a lot of fun.
Thank you.
And thank you to our live audience for joining us again this week, and especially all of those who submitted questions in advance. If you'd like to follow up with us at PAVE or one of the panelists on this topic, please reach out to us via our website at pavecampaign.org or just reply to your registration email. And as a reminder, we will be posting the full video recording of this panel on our YouTube channel and website later this afternoon. Feel free to follow us on any social media at PAVE Campaign to see that as soon as it's released. And next week, we'll be starting our March series of panels where we're going to do a technical deep dive on how AVs work. We'll be announcing that full lineup of panels on Monday, so be sure to check out our website at pavecampaign.org/events. Thank you all, and thank you again to our panelists.
Thank you.
Thanks.
Thanks.